I mean, the idea that the media are really worried about a second wave is just laughable. They just spent the last 2 weeks condoning, celebrating, marching themselves in protests across the country. And they told us that racism was the real health crisis in the United States. So these aren't serious people, and they shouldn't be treated seriously. Now, what does the data actually say? Yes, there has been an increase in COVID-positive cases in some states, but that's a pretty meaningless metric given that we're doing way more testing now. What's really important is the number of hospitalizations and ICU beds. For example, the media breathlessly covered the 1,902 COVID cases reported in Florida today. It's a record, they screamed. But the data shows that Florida hospitalizations have been trending downward for 2 weeks. That's great news. Hospitalizations are increasing in Texas, which is concerning, but the media are treating the state like it's another New York, which, as you can see, is just ludicrous, not the case at all. Now, Arizona has also grabbed the media's attention. They reported over 1,600 new cases today. But guess how many Arizonans were hospitalized for COVID on Wednesday? 1. Yes, that's right. 1 person in a state of over 7 million people. Joining me now is Phil Kerpen, president of the Committee to Unleash Prosperity. Phil, are they really going to try this after everything they've said and done over the past few weeks, losing all credibility on the COVID fear-mongering?
It's pretty amazing to see because when the riots were the thing and the protests, and that was the biggest thing going, they had the doctors and the nurses out there protesting with them, and now all of a sudden they want to bring back the fear and the shame and go right back to the old story they were on before that and just act as if that never happened. I don't imagine that people find it very credible, but, you know, they have the platforms they have and they're doing it.
Well, Dr. Fauci, who was fairly absent for most of the protests, he tried to explain some of the rise in cases in some states. Watch.
In some of those areas, not all, are seeing increases in hospitalizations. You're going to be seeing increase because you're testing. But once you start seeing increases in hospitalizations, in addition to that, then that cannot be explained just by an increase in testing.
Phil, what's the real explanation for this? Are too many people out there actually living their lives and having fun?
Well, you know, it's interesting because a few of these states have the same sort of trend going on, Texas and Arizona being the two that I've definitely looked at the numbers, and that is the daily admissions are flat or even slightly trending down, but the cumulative hospitalized is going up. And that means either people are staying in the hospital longer than they were before, or they're diagnosing people who are already in the hospital for some other reason. They take a test and then they get added to the COVID count. And so there's something going on with these numbers. We need more information to really understand them. But the most important thing is then the point you made with that chart before is these are still very low numbers. There may be a slight uptick. That's something you need to watch. And, you know, if it does become something more pronounced, then maybe give people, more advice to try to limit that spread. What we don't need to do is even consider going back into lockdown, which I don't think
it's just
was
never
at all
happening again.
Yeah.
The New York Times is trying to juice the COVID stats, Phil. They're saying that the Times is now including cases and deaths that have been identified by public health officials as probable coronavirus patients. Some states and counties only report figures in which a coronavirus infection was confirmed through testing. Phil, we've talked about this before, but this is the recommendation, is it not, from the CDC? They have guidelines. So if you don't get a test, but someone had COVID-like symptoms or flu-y symptoms, whatever, number of symptoms, they can check the box.
Right. The interesting thing about this, and the CDC does say to put the probables in the count, but New York State does not. New York State is excluding still New York City's very large number of probables, and that's why a lot of the sites you see, like the World Meter site has like 30,000 for New York, but if you go to COVID Tracking Project, which goes by the New York State, they're at about 25,000, which, do we think those deaths were actually COVID or not? I mean, if we really think they are and we're confident in that, then I guess they should be in the count. But the fact that New York is not comfortable including them, to me, indicates that they may not be. They may represent something else. Look, whatever these numbers are, whether they should be in or out, it doesn't have any effect or very little effect on where the country is right now and going forward, because tests are no longer scarce. They're ubiquitous. In fact, Medicare and most private insurers now require post-mortem testing before they'll pay out that something was COVID if you didn't have previous confirmation. And so I don't think we're seeing many probable cases anymore. It's going to be lab confirmed or ruled out.
A friend of mine in Minnesota told me today, Phil, that Minnesota is not getting noticed for something, and it's the fact that 81% of deaths from COVID, 81% are in nursing homes. Yeah. That is a stunningly high number. And Fairfax County, Virginia, counties around D.C., very, very high numbers as well. Maybe not 80%, but most of the deaths in many of these highly populated counties in the United States are coming from those facilities.
Yeah, Minnesota is really interesting because Minnesota is another one of these states like New York, New Jersey, Pennsylvania, where their post-acute care plan after someone was hospitalized is they send them straight into a nursing home, even if they're still infectious, which is a terrible, terrible policy. Almost all of the other states that were doing that stopped doing it. Minnesota is still doing it. They defend it. And the interesting thing about Minnesota is, when we point out that these bad policies of reseeding and pushing infectious patients into the nursing homes are one of the reasons we had these meltdowns in the northeastern states and places like Illinois and Michigan, the so-called experts from the left say, oh, no, 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 what happens in the nursing homes is all about how much spread you have in the rest of society because you can't keep it out. And the only way to stop and save people in nursing homes is to have these broad lockdowns. But Minnesota really proves that the wrong policies can lead to a high death toll, even if you have almost no deaths in the rest of the population.
Yeah, well, we're not going into lockdown again. We've seen the results of that. And we have way too many people out of work, too much time on their hands, and devastation to American businesses, depression, isolation, drug abuse. It is just, it's bad. So it's time to open up and rebuild prosperity. Phil, you may help us make sense of all this. Thanks so much.